If you're over 70 or caring for someone who is, this could decide how fast recovery happens after surgery. Age alone doesn't cause complications, lack of preparation does. Many people believe that after the age of 70, weakness before surgery is unavoidable. But the truth is, strength before surgery can make a powerful difference in how fast and safely the body recovers. Even a small amount of movement before surgery helps protect muscles, lungs, and balance. When the body stays active, it handles stress better, and surgery is one of the biggest stresses the body can face. As we age, muscles naturally weaken faster, especially during bed rest after surgery. If someone goes into surgery already weak, the body struggles more afterward, leading to slower healing, higher infection risk, and difficulty walking or breathing. That's why simple strength building before surgery is so important. Gentle walking, light stretching, chair exercises, and basic breathing exercises can improve circulation and oxygen flow. This helps the heart and lungs work more efficiently during and after the operation. Even short daily movement sends a signal to the body to hold onto muscle instead of losing it. Stronger muscles mean better balance, fewer falls, and faster independence after surgery. Breathing exercises are especially important because they help prevent lung infections like pneumonia, which are more common in older adults after surgery. The goal isn't intense workouts. It's consistency. A few minutes of safe movement each day can prepare the body to heal instead of struggle. Always follow medical advice. But remember this, strength is not about age, it's about preparation. Going into surgery stronger gives the body a head start on recovery, reduces complications, and helps older adults return to normal life sooner and with confidence. Many people underestimate the power of nutrition before surgery, especially after the age of 70. But food is not just fuel, it is medicine. What the body eats in the weeks before surgery can strongly influence how fast wounds heal, how well the immune system fights infection, and how quickly strength returns after the operation. As we grow older, the body absorbs nutrients less efficiently. This means that even people who eat regularly may still be undernourished without realizing it, going into surgery with low protein, vitamin, or fluid levels makes recovery harder. The body struggles to repair tissue, muscles weaken faster, and the risk of infection increases. That's why proper nutrition before surgery is just as important as the surgery itself. Protein plays a major role in healing. It helps rebuild muscles, repair skin, and strengthen the immune system. Without enough protein, wounds heal slowly and weakness lasts longer. Fluids are equally important. Dehydration can affect blood pressure, kidney function, and even mental clarity after surgery. Simple habits like drinking enough water and eating balanced meals can make a real difference. Vitamins and minerals also support recovery. Nutrients like vitamin C, vitamin D, iron, and zinc help with wound healing, bone strength, and infection control. In some cases, doctors may recommend supplements, especially if appetite is low. The goal is not overeating, but eating wisely. Small, nutritious meals prepared before surgery can prepare the body to heal instead of struggle. After 70, good nutrition is not optional, it is one of the strongest tools for faster recovery, fewer complications, and a safer return to daily life. One of the most overlooked but critical steps before surgery after the age of 70 is reviewing all medications. Many older adults take multiple prescriptions every day, along with over-the-counter drugs, vitamins, and herbal supplements, while each medicine may be helpful on its own. Together they can increase surgical risks if not carefully managed. As we age, the body processes medications more slowly. This means drugs can stay in the system longer and interact in unexpected ways before surgery. Some common medications, such as blood thinners, diabetes medicines, painkillers, sleeping pills, or blood pressure drugs may increase the risk of bleeding, low blood pressure, confusion, or delayed healing. Even supplements like garlic, ginseng, or vitamin E can interfere with anesthesia or blood clotting. That's why it's essential to review every single medication with a doctor or surgeon before surgery. This includes prescription drugs, non-prescription, pills, eye drops, inhalers, and herbal remedies. Never assume a medicine is safe just because you've taken it for years. Surgery changes how the body reacts, and adjustments may be needed temporarily. Another reason medication review matters is brain health. Certain drugs can increase the risk of confusion or delirium after surgery, especially in older adults. Reducing or adjusting these medications before surgery can help protect memory, awareness, and overall recovery. The goal is not to stop medicines on your own, but to use them safely and wisely. A proper medication review helps prevent complications, improves anesthesia safety, and supports faster healing. After 70, managing medications carefully before surgery isn't just a detail, it's a powerful step toward a safer operation and a smoother recovery. One of the most important but often overlooked steps before surgery after the age of 70 is protecting brain health. As we grow older, the brain becomes more sensitive to stress, medications, and changes in the body, making older adults more prone to confusion, memory problems, or delirium after surgery. These complications are not inevitable, and with careful preparation, they can be minimized. Good sleep before surgery is essential. Lack of sleep can increase anxiety, slow healing, and make the brain more vulnerable to confusion after anesthesia. Wearing glasses or hearing aids is another simple but powerful step. Sensory deprivation, like being unable to see clearly or hear properly, can worsen disorientation and make recovery more difficult. Keeping familiar routines, such as regular meals, light exercise, or reading, helps the brain stay active and alert, which can reduce the risk of post-surgery delirium. Mental engagement also plays a big role. Simple activities like puzzles, conversation, or listening to music stimulate the brain and improve cognitive resilience. Stress management is equally important. Meditation, deep breathing, or calming exercises before surgery can lower cortisol levels, which supports both brain and body recovery. Even small steps, like having family nearby for reassurance, make a difference. Protecting brain health isn't just about avoiding confusion. A sharp, well-prepared brain improves decision-making, follows rehabilitation instructions better, and helps the body recover faster. It also provides confidence and peace of mind, which are crucial for older adults facing surgery. By focusing on sleep, senses, routine, and mental engagement, patients over 70 can give their brain the best chance to stay healthy, alert, and ready for a smooth recovery. One of the most important steps for a smooth recovery after surgery, especially after the age of 70, is planning ahead. Recovery doesn't start after you leave the operating room, it begins long before, with preparation at home, support systems, and a clear plan. Without careful planning, even minor challenges can become major setbacks, leading to slower healing, complications, or even rehospitalization. Planning starts with your environment. Remove tripping hazards, secure loose rugs, ensure good lighting, and keep frequently used items within easy reach. A safe, organized home reduces the risk of falls and injuries, which are more common in older adults after surgery. It's also important to arrange for help with daily activities such as cooking, cleaning, bathing, or transportation. Even a few days of support can make a huge difference in energy levels and overall recovery. And in your post-surgery care plan is just as crucial. This includes knowing how to manage medications, when to do physical therapy exercises, and how to monitor for warning signs of complications. Preparing questions for doctors or nurses in advance ensures you have the information you need to act quickly if problems arise. Planning meals, hydration, and gentle activity schedules also helps the body heal more efficiently and reduces stress for both the patient and caregivers. Emotional preparation matters too. Accepting that recovery may take time and having realistic expectations can reduce anxiety and frustration. Involving family members or friends provides encouragement, reassurance, and practical support when recovery is planned carefully. Older adults are not only safer, they regain independence faster, avoid unnecessary complications, and feel more confident in their journey back to normal life.